It's a little-known but rapidly progressive and deadly disease which can strike anyone at any time. Pulmonary hypertension, or PH as it's known, is a condition of the lungs and heart, and a campaign to raise awareness of it has been launched on Rare Disease Day.
The symptoms of PH are most of the time shortness of breath, also dizziness, also chest pains, sometimes blue lips, and these symptoms are very frequent in each heart or lung disease. And so that's why it's difficult to diagnose.
And today in central Brussels, information explaining more about PH was handed out, along with blue lip balm and blue lip-shaped lollipops to highlight one of the main symptoms of the disease.
We should keep on informing people about this kind of disease.
Yeah, I've heard about hypertension, but not about pulmonary hypertension, no.
The so-called Breathtaking campaign is led by the Pulmonary Hypertension Association Europe, a Europe-wide patient group who work tirelessly to ensure patients with PH have access to the best possible standards of care.
The Breathtaking campaign is very important because pulmonary hypertension is a rare and very little-known disease, and patients are being diagnosed still extremely late in time with dramatic effects on their prognosis and quality of life.
We really hope to achieve from the Breathtaking campaign more attention from patients, attention from doctors, from politicians, to find funds for research for our ultimate goal to find a cure.
Media from across Europe also gathered to learn more about PH from leading medical experts and heard how time is so crucial for patients with the condition.
Time matters for patients in PH at every step of the disease. The first step is time of diagnosis, because when it's left undiagnosed, PH is going to kill you within 3 years on average. Time matters also when it's about to treat patients, because if you wait too long, the disease also will evolve and ultimately, unfortunately, lead to heart failure and death.
Central to today's event were patients with PH and their families, who spoke about how the condition has had a dramatic impact on their lives.
The effects of my life wasn't easy. I hadn't breath enough. I couldn't work anymore, and it was impossible to have a normal life.
A specially choreographed dance routine was created to give a powerful visual representation of what it's like to live with the disease.
The slow movements reflect the fact that people with PH have to slow down their lives. With our facial expressions and hard breathing, we try to show how difficult it is to get enough air.
Today's events have helped raise awareness of PH, but there's an urgent need for more research and better therapies. That's because accurate and early diagnosis, together with effective treatment, can help save lives.